So what can I do about my depression? Well, the first thing that's important is to get out into the world. Try not to stay at home all day, even when feeling down. Take a trip to the park, go to the cinema, or meet a friend. Volunteer your time. Helping others is one of the best ways to feel better about yourself and to expand your social network. Take care of a pet. A pet can keep you company, and walking a dog, for example, can be good exercise for you and a great way to meet people. Create opportunities to laugh. Laughter provides a mood boost, so swap humorous stories and jokes with your loved ones, watch a comedy, or read a funny story. Remind yourself that depression is an illness, not a sign of weakness. You are not being lazy or letting other people down. Tell someone if you feel so low that you have thoughts of taking your own life. Watch your drinking. Alcohol can make depression worse. It can also react with any medications you are taking. Sleep is extremely important, so try to avoid alcohol and caffeine, keeping a regular sleep-wake cycle and making sure your bedroom is dark, quiet, and cool. However, if these things don't work and your sleep is still poor, try not to panic. It will get better when the depression lifts. Make sure to eat well and try to eat every 3 to 4 hours. Not eating for too long can result in fatigue and irritability. Take regular exercise if possible. It is recommended to exercise for at least 30 minutes 5 times a week. This can include parking further from the store, taking the stairs, doing light housework, or enjoying a short walk. Be kind to yourself. You might need to change your routine while you are unwell. Try not to change the tablets you are on without discussing it with your doctor. If your tablets have side effects, tell your doctor or nurse.
You might ask yourself, what about professional help? I would really like to emphasise that less than half of those with depression get any professional help, despite the fact that depression is very treatable. Untreated depression can cause strain on relationships, drug and alcohol use, and suicidal thoughts or attempts. With proper assessment and diagnosis, recovery from depression can begin within weeks of commencement of a treatment plan. Most people go on to live healthy and happy lives with treatment. Older people tend to think more about physical problems than about feeling depressed. You may have been brought up not to bother the doctor unless you have a physical complaint. Sometimes, the first sign of depression can be a constant worry about having a physical illness, even when your doctor can't find anything wrong with you. If he or she tells you that you are depressed, it may feel as though you are not being taken seriously. This is not the case. If you or someone you love is experiencing symptoms of depression, your first point of contact is your GP. Following assessment by your GP, they may recommend that you are referred for an assessment at a community mental health clinic, or alternatively, your GP may suggest that you need to come into hospital. There are 3 different types of treatment. The first is medication. Treatment of underlying causes, for example, being low in vitamins or iron. Treatment with antidepressants. Side effects can be discussed with your doctor and monitored appropriately. Antidepressants work a little bit faster than talking treatment. Although some people prefer talking treatments, others prefer tablets. You can also have both at the same time. Complementary therapies are helpful but need to be discussed with your doctor in case of side effects or medication interactions. As for talking therapies, psychotherapy or talk therapy can be effective. It helps by teaching new ways of thinking and behaving and changing habits that may contribute to depression. Psychotherapy can help you understand and work through difficult relationships or difficult situations that may be causing your depression or maybe making it worse. They are very safe. But sometimes psychotherapy can bring up unhappy memories from the past. A good therapist will know how to deal with this. If you have any concerns, you should discuss them with your GP or with your therapist. With regards to practical help, a social worker can help you to get advice on financial or practical support, or even moving house. However, it is usually best to put off big decisions like this until you are feeling much better. Professionals can also help you find ways to spend time with other people, such as support groups and day centres, that are in your local area. This can be very important because it's easy to lose touch with people when you're feeling depressed.
What role can family members play in helping someone with depression? For depressed older individuals, raised in a time when mental illness was highly stigmatised and misunderstood, it can be even more difficult to ask for assistance or to fear becoming a burden. The main thing that a family member can do is to listen, to offer moral support. Suggest activities to do together that your loved one used to enjoy, whether that be a walk, an art class, a trip to the museum, or the movies. Depression is less likely when people's bodies and minds remain active. Schedule regular social activities. Visits from friends and family members or trips to the local community centre can help combat loneliness. Be gently insistent if your plans are refused. Plan and prepare healthy meals. A poor diet can make depression worse, so make sure your loved one is eating good foods. Encourage the person to follow through with treatment. Depression usually recurs when treatment is stopped too soon, so help your loved one keep up with his or her treatment plan. If it isn't helping, look into other medications and therapies. Make sure all medications are taken as instructed. Remind the person not to drink alcohol while on medication, and help them to remember when to take their dose. If you have any concerns about suicidal behaviour, contact a health professional immediately.
So in conclusion, depression is a very common illness that only becomes more common as we age. For many people over 65, depression carries a stigma, and this can often discourage people from seeking help. Although we experience losses as we age, and this brings a certain amount of sadness, depression is not a normal part of aging and should be treated, as it is a very important condition in its own right. Older individuals may not feel sad as such, and may notice other changes such as increased fatigue and worsening physical problems with no clear explanation. Certain medications and medical illnesses can also cause or worsen depression. If you are concerned that either you or a loved one is depressed, it's very important to seek professional advice. Antidepressants and talk therapies are the main treatments for depression. It is also important to look after your own mental health by being kind to yourself, seeking out joyful activities, and staying in regular contact with friends and families.